stocking net. You don't need to cut this at the side here because you're going to be folding it back and it's not going to interfere with the bolt here. Cover up the styloid. So this time we're reversing it because that's that way for that arm, and this way for this arm, just to get the. It's just you don't want any plaster tears or the soft band next to the skin. It can be a bit of a itchy. But it's the same. I'll do it backwards. So it's twice around the top, and then make this nice and firm, 50% coverage there. You're going to cut from there up to halfway. And then we'll take this one down over the metacarpal head, so you're going twice around there. And then we'll come back here, clear that off. And just over there. Now for this one, you don't ever set the fingers straight unless it's an actual finger injury and the doctors have asked for it in a Zimmer splint or something, but you're going to want the wrist up. When you're ever doing casting, you can see that's your functional position. We don't get around standing like this. So that's your functional position, but this is an exaggerated one. You just want to bring that up to get those fingers into that sort of a cobra head sort of. So the best way to do that is when you're plastering it, just get your other hand in there and that'll get it in the right position. But to measure the gutter, you're wanting a piece of plaster to go from here to here, all the way up the arm. So it's just a gutter frame. So I'll use my measure. So I'm measuring from here, because this is a 4th and 5th metacarpal fracture. So you want to go from there around to there. So that's the width that you want to put on, and your length you're wanting with the finger, there's the IP joint there, so you're wanting to go from there to there. So that's how much length you want. So first up you've got to work out the width, and conveniently that's 15 centimetres, so that's that piece there, and the width was this. So that's your length and your width worked out. That's always what you've got to, when you're putting on a back stab, you've always got to know the length and the width. This little clip here is here for a reason. It keeps the 4 layers together so that you don't, by mistake, just put 3 layers on. It sits better if you cut both ends like that. And they're called a gutter because it's in the shape of a gutter. It's going on like that. So that's going to fit. Here's the metacarpal heads, that's the IP joint, so you just go into there and it's going to go up the arm like that. And going to reinforce those fractures of 4th or 5th. If you were having the third one, if it was involved, you'd really want to get probably a size 20 to wrap around there, because that would give it more support, and then you'd have the wee gap along the top. That's great. This morning for your
Did some jigsaws
Okay,
for teamwork and communication skills. Yeah, let's go.
right, holding both ends into the water and out of the water. Just get that full on your hand. Don't squeeze all the water out of it, it'll just absorb into the plaster product, and don't go like that and down like that, because that'll take all more product off it. where that's going. There's the IP joints there, so you're just going to put that on that side there. Sweep it on. Bring that up on the inside. And after a minute or two, that will actually stay on there. Gravity wants to pull it off. Three hands for this one.
Who's got your phone and take a picture of Shandy with you to take us on?
And then ring through Bamford and say, I'm not
So this is when you hold your hand behind there and get your fist in there, and that will force that, because it's hard for patients to constantly hold their hand in that position. So do it on their side for a start, and then when you're finished, just get your hand in there, your knuckles, and that'll force it into that position. And that way you're sort of mid-shaft down the arm, the thumb's totally free, and then the fingers are free from the IP joint.
So this is different than the functional position of the cup or how
The cup's for the scaphoid. But you'd get your glass of wine in here. Quite easily.
Thank God.
You can't wipe your bottom though. That's alright, that's not important. A glass of wine's important.
Okay, so you'll feel that going hard once it's gone hard. If you take your hand off too soon, then it's just going to relax and they will just push, it'll slip back into just their functional position rather than their forced cobra position. And once you're finished, while you're doing this, you can be telling them about how to care for the cast. Keep it clean, can't work with it, can't get it wet. And the appointment will come in the mail to them within 2 weeks. And
Do you ever take the fifth finger to stop rotational?
yeah, I do. I've got that here. Usually put a wee strip of gauze in the finger, in between there, and tape it top and bottom, and that stops the rotation of the finger. So that is often asked for by the doctor.
Yeah.
If it's quite a, not displaced, but if it's quite a marked fracture there. So that's all I do is there. And if it was the tooth, depending on where the fracture is, whether you would do, you might do the three of them to stop the movement. That's usually what we do.
what was it stuff falling in you put on it?
This
Tape
is
or
just
something?
Gauze.
Oh, just gold.
That's
This
just to
is
stop
buddy
any
strapping.
fungal growth. Yeah,
Oh.
we're buddy strapping it basically, and it stops the movement. When you close your fingers, that rotates over. And then you just buddy strap across there and across there. And that would be, you would see that there, so we keep those two fingers like that. And so that, as you can see, it's kind of more forced, that position there, rather than this one here, which is more just a functional position. And then they come often only in that cast for about 3 weeks. And this one here, they'll be in this one 2 weeks, come out of it and go into fiberglass, or if it's been manipulated collies, then they might stay in it, depending on the position and how, whether it's, sometimes they slip off and come back, you know, with the first clinic appointment, they have an X-ray and it's slipped again after they've been manipulated. So, this one here, to remove it, you'll just get your scissors and you just cut it off at the girders basically. So with swelling, it's always important that you have a good 5 centimetre gap at least down there, and you just cut down here. Scissors should always be lifted up away from the skin. Never use ordinary scissors, always use a blunt tip scissor, and then that'll just pull off. And out of there. And get the other one off. You and I get the privilege of wearing, the others can put their hands over your hip. And plug.
Yeah.